And we are live. Again, my name is Dr. Chad Kuntz, kind of a virtual setting of the Primetime podcast due to COVID. And I'm really excited because today I've got PJ Isaac. She is a Pilates instructor, and I'm really, really excited that you're able to hop on today. So thanks for being here, PJ.
Thank you, Chad. I really appreciate it. Yeah.
Absolutely. So we're going to kind of just jump in. Tell us a little about who you are, how you get started with Pilates, and what drew you to be an instructor?
Okay, great. So I have been an instructor for many years. So I started taking classes, and then I became an instructor, a group exercise instructor first. And then,
Okay.
so I've done that for 29 years. And in that course of 29 years, for about the last 18 years, I got interested in Pilates. I was taking a class, actually, one of my class participants became an instructor
Mm-hmm.
in Pilates, and I started taking her class. It was after mine, and I enjoyed her, so I wanted to take her class. I really enjoyed the movement. I was teaching step aerobics and things like that. We'd kind of developed athletic conditioning, which became boot camps.
Sure.
And the Pilates was so different. The movement was different, and I just enjoyed it. It was still a lot of strength movement without like the jumping intensity. You know what I mean?
Yeah.
So,
Yeah. Maybe. Yeah.
yeah. So then I decided I'm going to get certified in mat Pilates. So I did that. And then I started seeking more. I know that there's more equipment and more to Pilates than what I had learned. So I sought a place. It's actually not that easy. It wasn't in Charlotte to get the training. But I did find somebody in South Charlotte who was training instructors because it's called comprehensively trained. So it's 500 plus hours
Oh, wow.
of
That's a lot of
training.
hours.
Yes. So it's pretty intense. And
Yeah.
then there's different equipment to learn on.
Give us an idea of how much equipment, because I think most people are kind of familiar with the reformers, right? But there's more than that.
Right. So, yeah. So the reformer, and it's called reformer because, well, there's that too. So Joseph Pilates is a person. Um, yeah. So,
So I could go the Kuntz method. You could do the Isaac method, or the Isaac, just Isaac.
PJ Isaac method.
Yeah.
Yeah.
Exactly. Nice. Okay.
Yeah, exactly. So, um, I know he became a verb.
Yeah, he
Um,
became a verb. It's
can
funny.
do Pilates. So he developed the reformer to reform our bodies. And the reformer is the most common piece of equipment that you'll see in studios. And then there's the Cadillac.
Okay.
And the Cadillac, I think I've shown you the Cadillac when you
Oh
came
yeah.
into the
Oh yeah.
studio.
Yep.
And the Cadillac has this trapezius piece above the bed of the reformer. Um, and he called it the Cadillac because it's like the highest quality, like the
Sure.
Cadillac's was the highest quality car out there. So,
Right. Right. Makes sense.
um, yeah. And there's a ladder barrel. Um,
Yeah, you
and
showed me that, and
that's
that was really cool. And one of the reasons I asked you that is because I think there's a lot more to Pilates than people even think about. If you went to 10 people and asked them right away in one sentence, how would you describe Pilates? You might get a pretty similar answer. I'm not sure. But what I think people aren't aware about is all the kind of accessory cool pieces that I know you showed me that hopefully we can continue to expound on today that has a
yeah.
lot of other benefits rather than just like lower abdominal control or pelvic floor control and maybe some of these like typical things people might attribute or associate with Pilates.
Right, right. Yeah,
Yeah.
yeah.
So it sounded like one of the intriguing factors of getting into Pilates was avoiding kind of the amount of compression or shock that you might get with like jumping. That's kind of something you said, right? Like, because
Right.
that's something I see a lot with my clients too, the fear of hurting themselves. let's say they've got a back injury or hip injury, it's kind of like, yeah, jumping's a lot, or plyometrics, or these really high intensity classes may be more harmful than helpful, just because of the
Right.
current state they're in and the injuries they've had. And it sounds like that's one of those things that kind of invited you in to learn more about Pilates, is because it's kind of a gentler way, but to still get a lot of benefits.
Well, exactly. And I agree with that. So yes, when I notice I'm not jumping as much as I'm doing these, it was mat Pilates that I was doing, so I'm on the floor. Um, and jumping, I was young when I started, so jumping wasn't as much of an issue for me physically at the time. But as I've aged, Pilates is something that is actually for everybody, and not just everyone, but every physical body, because it is it is not going to hurt your joints,
Right,
right? So if you can take different types of bodies in different conditions.
right,
So if
right.
somebody has an injury, we can ask them about that, and then of course adjust their workouts for that. And so without that jumping, and which I think, of course there's a place for that, right?
Sure.
And to increase your metabolic rate and all of that. But and Pilates has its place too, where there's a lot of benefits for what we're doing.
Yeah, I wanted you to kind of expound on that. So if someone's kind of thinking about doing Pilates or interested but never really quite committed, what would you say some of the main benefits would be when utilizing and performing with Pilates?
It's a great question. So there are so many benefits, right? Um, One of the things that we are really looking at postural alignment. So there's Pilates works the core. I read an article that said, Pilates owns the core, and I
Nice.
just love that, right?
That's cool.
And so when you're doing Pilates, you are strengthening your muscles as well as lengthening your muscles. And you want to uh, train your core to be strong enough to hold your spine alignment in neutral.
Nice.
Teaching people how to find neutral spine and maintaining a neutral spine, which is what we want when we're standing. So you have good postural alignment in standing. So as we age, some people have different spine conditions, like kyphosis, and they're getting older and they're getting that upper back rounded.
Right, right.
Some people naturally have, young people, some have that natural lordosis, that deep lower back curve. A lot of spine injuries are that L4, L5, right?
Right, absolutely.
You see a lot of that, I'm sure. And so that can be, a pelvis misalignment.
Right,
Uh,
right.
and so getting the pelvis in neutral and training the body to stand that way, not just lie that way, right?
That's one of the things I really love working kind of with you and with Pilates in general, is I feel
Yes.
confident when I send people over there, or when I encourage people to go do Pilates. It's usually one of the best things for them to learn how to move their pelvis, to move their lower back. I tend to find
Yeah.
so many people are guarded in their lower back, especially if they've had pain, they just don't want to move it. But Pilates teaches you to not only get access to that range of motion, but then to find, and you nailed it, neutral spine, and then
Right.
to lock into that. And that's something that, God, I'm a huge advocate of, because of just what you said. Most people come in with too much extension or lordosis, and
Right.
getting them out of that can take a lot of repetitions too. It sometimes, a lot of times, takes more than just the exercises I give them or the deep tissue work I give them. It's going to be, you're going to need a lot of reps in this, because I can tell your nervous system doesn't want to go to neutral. It wants to hang in that kind of pseudo-stable position where they're extended, and you need to get out of that. And what does that require? It requires the core, lower abdominal muscles, and even the pelvic floor muscles inside the pelvic
Yes.
girdle to kind of work together. And
Right.
particularly, I'd say culturally, Americans have no idea how to move their hips.
Yeah.
They really don't. But it does require that dissociation in order to do Pilates.
Right, right. And when I talk about, the core muscles, and people, when you talk about core, they might generally think rectus abdominal muscles, kind of what we call those mirror muscles when you see in the mirror,
Oh yeah,
that
yeah,
six-pack abs,
yeah,
right? There are
yeah.
people, oh, I'm going to get that. So they would think, oh, I can do a lot of upper body, crunches, lifting the
Right, right,
upper body to
exactly.
lower body. When your core muscles are the five muscles that don't even actually include rectus abdominis. It's pelvis floor,
Right.
um, you know, your multifidus muscles, going up your spine, your respiratory diaphragm
Yeah.
included in that. Um, and I tell people, I said, if your respiratory diaphragm is a core muscle, breath is so important.
Really is.
And
Yeah.
it is the number one principle in Pilates is breath.
Nice.
So,
Nice.
yes, isn't that
It's
nice?
awesome.
Yeah, so breathe, people, breathe.
I mean, I think I heard we breathe like 18,000 times a day, but
Wow.
yeah.
Yeah.
However, we we
Hold your breath the
shortchange
rest of the
ourselves
time.
on that. That number might be wrong. I hope we breathe a lot, and
Oh,
the purpose is we need to be able to do it the correct way. If you have that many repetitions, right, and
right.
so many of us get in the accessory in the upper chest, and we kind of totally
Exactly.
lose insight on how to or where we should be getting it from.
Mm-hmm.
So,
Right. Yeah.
well, I'm
Carrying it
curious,
through.
PJ, how are you kind of personally managing providing Pilates and its benefits during this crazy COVID-19 scenario?
Oh gosh. So yeah, COVID-19's been crazy, right? Everybody's responding differently. So some of my clients are, the great thing is being able to do it remotely, like we are today,
Sure.
right? Being able to still have conversation and see them via Zoom meetings or um, FaceTime. That's been very helpful.
Nice.
Yeah. And so I've been still training clients that way. Now, people don't typically have a reformer.
Hmm.
It's an expensive piece of equipment to own. And I have one in my studio, and then I work places where there's reformers. So what I've been doing on my Instagram is I've been posting a movement on the reformer and then translating that to the mat. But I do train them remotely right now.
Awesome.
And yeah, so that's been working out really well because, it's so mindful. Pilates is so mindful that it does help. It's the mind-body connection. And
Well said. Yeah.
yeah, so it really eases that stress as well,
Yeah.
right?
It gives them a place to kind of tap out of all the chaos that's going on, bring about some mindfulness. It's not solely about the mechanics, nor really is any
Yeah,
good fitness or professional service.
right,
When people come to me, or even if I'm doing it online, it's about kind of putting on the mental cap, being more present, being more aware, quality of movement. This stuff doesn't
right.
just go away just because you're unable to be in person. There's a lot of things that you can continue to work on and be mindful of in this time period. So I love that you said that. So,
Yes, yeah.
so I think not
So,
only now during kind of the online version of Pilates, but when this is all said and done, people can get back into the in-person stuff. How would someone know if Pilates is right for them?
oh, that's such a great question because um, again, Pilates is right for everybody. So if you're looking to say, oh, will my body be able to do that?
Right, right,
Maybe somebody's in their 70s or 80s. We have clients that are in that age range. Yes, their body can do it.
hmm
I have these young women and men that take my class that are in their 20s. Um, and I have had clients that have had pretty severe scoliosis. Sometimes we think when we have these physical conditions
Yep.
that we have limitations. There are no limitations. There's always a movement and position that we can put them in that will make them successful in their practice.
Nice. That's
So,
awesome.
yeah,
Perfect.
yeah,
So let me ask
it's
you, because I know a bunch of people that have told me they might be a little nervous to go do Pilates because they've suffered from chronic low back pain or tightness or achiness.
yeah,
So let's kind
yeah.
of just identify that type of person. How will they know that you can confidently help them without them hurting their back again when they do Pilates?
Right. That's a great question. So they can, so the first thing that we do ask is, we get a little medical history on them and say, and in fact, every time I work with somebody, kind of what's going on today, how are you feeling, and so they have that opportunity, number one, to tell you what's going on. I think that's really important,
Nice.
not just to start a program, but start where you are.
Right.
And so if they're having some lower back pain, my husband has, he had ruptured a disc years ago. So he continues to kind of tighten up and have some tight hamstrings,
Right.
things
Right.
like that. So you one, ask them, and two, when they have something going on like that, it's all the different movements are, again, they're lengthening the muscles as well as strengthening. It is a system that's, a reformer has springs. Now, a mat Pilates class is different. It is all your own body weight, right?
Right.
So
Sure.
that is harder. So you're going to have to modify more in a mat Pilates class. In a reformer class, you're using springs for resistance, and so you make sure that they can know and get into neutral spine, and then if they can't stay there, then we show them how to imprint their spine, their lower back. It gives some release, right? And how to take those releases, how to find that, and then give them opportunity to take that little break. But lengthening your hamstring muscles is also going to release that lower back, right?
Nice. Yeah, absolutely.
Yeah.
I love it. So first, you carefully identify the issue that they're having that problem. A lot of people will go into places and they may not be screened, and they just get thrown right into a program, and then they've got
Right.
this fear: is that going to happen to me again? But it sounds
Yeah.
like you're saying we're going to identify it. You're going to get them into neutral spine, which is arguably the most safe position that your spine can be in. You're going to teach them how to release the tight muscles in the low back, which is, again, a really common impairment with those with low back pain. And then send them out on their way with the understanding of how to move their lower spine better and how to engage their core a little bit better, which is a lot of what I do as well. I think we run in parallels with that too, which is fantastic. So
Exactly.
yeah, if people are on the fence watching this or listening to this later, it doesn't hurt to just go in and meet you or talk to you, right? And just say, hey,
Absolutely.
maybe I've tried Pilates in the past, but they didn't work with you. And I think that's similar to any profession, right? They didn't work with PJ. You might have a slightly different spin or a slightly different angle in how you can help them enjoy Pilates rather
Right.
than maybe where they've tried somewhere else. So if you're on the fence, and we'll get into this a little bit later, how people can get started with you, but
Okay.
I'm sure it doesn't hurt to just go out, try a class, and go from there. So
Right. I'm going to do that as a professional. You go and you try other instructors' classes, see. We all learn from each other.
sure.
And I think that's beneficial even for our clients to, definitely know different things that are out there and what works best for them,
Right.
for sure.
Absolutely.
Yep.
So I'm kind of curious, where do you see the future of Pilates going in the next 3 to 5 years? There's like so many changes going on right now and just health and fitness. I mean, I feel like there's a new product created every day. There's new different types of services out there. Where do you see Pilates going in the next 3 to 5 years?
I am so excited about where Pilates is going, where the fitness industry is going.
Nice.
Pilates is just getting more and more exposure. You see, there's, I work for Club Pilates, which is a chain across the country, started in California. I work at the JCC, and yeah, people are being more and more exposed to Pilates, which I think, like I said, I've done it for the last 18, maybe it's been closer to 20 years now. And before we were bringing mat Pilates, and reformer and doing a class in Pilates was pretty exclusive,
Sure.
like all of the famous people were doing Pilates, and they've been doing Pilates a long time. It was an expensive type of exercise. Because like I said, the equipment's expensive to own.
Right.
And so with Club Pilates being set up the way it is, and you have several reformers in the room, it's exciting to me to have so many people being exposed to it. And I think that's just going to continue to grow.
Yeah.
That the idea of not just having a room with one Pilates or two Pilates reformers in there, that you can have more than that, and you can effectively teach more than one or two or four people at a time.
Right.
You can teach in a class format. Yeah. I think that's pretty exciting. That's going to grow.
Yeah, that's awesome, and I agree with you. It is good to see, and especially with COVID-19, you'd hope that we get even more people on board with trying to take care of themselves, and I think the health and fitness industry is already heading that way. With just so much more opportunity for people to try and see and do different things. So we hope to continue to see kind of this push and exposure into various different types of ways of exercising, which I think is a really good thing. Cross-training in general and learning from different fitness professionals underneath different umbrellas of services is just a fantastic thing. So I too hope just to see people continue to just try out, if nothing else, Pilates, and just to kind of see how it can help them, So
it'd be great.
Talking about that, so tell me more about the different classes that you guys offer, or the ones that you teach, and maybe give people an idea of how each class is different and how it serves them.
Right. So I teach a couple places. So I have my own studio, and I have, I take one-on-one clients. And that's a nice setting for a lot of people, very comfortable, and that's what they like. And then if you like a class setting, I mentioned I teach at Club Pilates. There's Club Pilates, there's few locations in Charlotte. There's Club Pilates Strawberry Hill, Club Pilates South Providence. You've been there.
Yep.
And there's some others. It's a franchise. So there's 12 reformers in that setting, and they're set up in stations, which I really like. Everybody has their own equipment. And the class formats there, you can do what we call flow formats, which there's classical Pilates, and then there's more contemporary.
Okay.
And as I'm trained classically, which is a great way to get trained, and your foundation moves on from there. And then you can, become more contemporary with your movement once you understand and know all the foundations. So you might get into formats that are more contemporary, where we do what's called a FIT class. So it's functional interval training.
Cool.
And so we always use the reformer for 50% of your workout, and then you'll do functional interval training for the other 50% of your workout. So it's really neat to do combination style classes.
Nice.
I teach at the JCC. There's 4 reformers there for the members, and non-members can come into the JCC for Pilates classes. It's just a different rate. And kind of do the same type of thing there. It's my class is already set with the 4 reformers, and you sometimes it's based on what they need that day.
Yeah.
So
Excellent.
for that setup, but at Club Pilates, there's a definite schedule, of what you're getting.
Yeah.
So
Okay.
yeah,
Awesome.
and different levels too. So that's nice.
Yeah, absolutely.
You kind of judge that as an instructor when you do that on your own. What level do I have a more advanced client, because there's movement that's more advanced. Like I wouldn't have you start out on the reformer and say, okay, Chad, let's stand on the reformer today. And you've never done that before. You want to progress. So you do a lot of movement lying down. Then, you start getting stronger in your core. You do some movement where you're kneeling on the reformer. You're getting,
Nice.
as you become more stable, and you have more proprioception, to be up, and because you're up and moving and you're off the ground, you have to have some good stability and proprioception to do that.
Love it.
And especially then when you stand on the reformer.
Oh yeah.
So yeah, it gets into how do you format the class then,
Yeah.
based on your abilities.
Heck yeah.
Yeah.
Love that.
Yeah.
Okay, great.
Well, yeah.
Well, let me ask you like one last question. Then I definitely want people to know, how they could get started working with you, and just double check all those things. But sometimes I feel like, and I could be wrong, but Pilates kind of gets mixed into this bag, similar to bar or yoga, for example. How would you say that Pilates has kind of differentiated itself from doing either of those two types of exercise modalities?
So let me just say, like, I love all types of exercise. Like I said, I've been an instructor for so long, and I think people need to find what works best for their bodies and what they like to do so that they move. That's
Right.
the most important thing, right?
Yeah.
We would just want people, and that's one thing with the COVID-19, like, yes, we are in different areas of the country, people are more, confined to their space. So what can I do within this space, right? Like I have a lot of yard, and I can go outside and be in the yard. I could do sprints in my yard, right?
Right.
But so anyway, I was trying to circle back to your question. I was trying to remember it.
Yeah, just wondering how it differentiates itself from yoga or bar.
From yoga and bar and all of that, yeah. So yeah, finding what you love to do and how to move, I think is first most important. And so I've done yoga, and I think there's definitely a place and time for that for everybody's. People either they love it, want to do more of it. People that come to Pilates. They've tried other things and it becomes their thing. It's like I said, Joseph Pilates had this vision that everybody would do this. It's a spirit, mind, body, so that it would relieve stress, it would relieve depression, it would relieve all of these things and get our bodies, he said the breath is like taking an internal shower, to cleanse your body. It can
Nice.
be all of those things, as well as strengthening your body. So it has. I love bar class. Again, I think it's just what feels right in your movement.
Nice.
Does that make sense?
Yeah.
Yeah.
Basically,
Yeah.
if nothing else, try each and every one of them and see not only what helps you the most mechanically, but also what your whole body needs, kind of a holistic
What you're
touch.
connecting to. Exactly.
More
Yes.
energetically, mindfulness, stress levels, depressions, maybe what really clicks with you.
Exactly.
I think every form of movement should have a mindfulness to it to some degree. So that's
Right.
and I think it's fair to say I really haven't done too much bar. I might have taken a class or two before. I've definitely done your class a few times in yoga. From my understanding, my perspective, definitely an appropriate kind of mindfulness, relaxation. Breath is heavily incorporated as it should. So it sounds
Right.
like the very minimum. Try them out. See what you connect with the most. And if you need a little bit more of a one-on-one attention with Pilates, it sounds like that's an option with you too.
Exactly. Right. Right.
So
Always.
how would someone get started? And let's say they're kind of nervous about Pilates, they'd like to work with you one-on-one directly. How would they get started with you on that?
So one-on-one directly, they can find me. I wish I had a website. That would be great. I'm
We're
working
working
on
on it.
things like that.
Yeah.
But yeah, exactly. But you can always find me on Instagram, PJ_Isaac, and it's ISAAC. So you can find me on Instagram. You can find me on Facebook. It's PJ Capella Isaac on Facebook, and send me a message. I don't mind if people just give me a phone call. 704-619-0262 is my cell number. So if they wanted to reach out and just text me or give me a call, I'd be happy to work with them and first find out if it's reach out and find out if it's a good fit for them.
That's perfect.
Yeah.
And then they can also find you at the JCC in South Pilates.
They can find me at the JCC, and they can find me at Club Pilates, Strawberry Hill. That's where I am most of the time, is
Okay.
Club Pilates, Strawberry Hill location. Yeah.
Okay, great.
Yeah, that's on Providence and Sardis Road.
Awesome.
Strawberry Hill, yeah.
Well, thanks so much, PJ, for hopping on and telling us a little bit about your insights and your experiences with Pilates. Again, it is one of those things that I think people should strongly kind of check out, and maybe if they've got a little more time on their hands, they could at the very minimum kind of build a connection with you, relationship with you, hop on a Zoom or FaceTime or something similar to what we're doing now, and just kind of have that discussion. These are my concerns, these are my fears with Pilates. How could this best benefit me? Let me kind of learn some introductory movements, and then when all this COVID stuff clears up, get back into the one-on-one or group setting with Pilates and kind of experience the real deal.
That would be great. Yes, that would be really wonderful. I can't wait until we are able to, connect again and one-on-one.
I hear that.
I know you're ready for that with your business as well.
Yeah, we're transitioning, like I said, to one day a week as in next week. There's just so much chaos in the air. It'll be great when everything settles down and we are back to normal. But that being said, people can still experience movement and mindfulness even
Absolutely.
right now, and we don't want to lose sight on that either.
Yeah, during this time, we definitely can work together. That's
right.
for sure. Yeah.
Well, thanks so much, PJ. I'll be talking
Thank
to you
you.
soon, and enjoy the rest of your day.